Please welcome Dr. Mignonne Morrell, LSU Health New Orleans radiologist based at UMC. Well, I guess we'll start with a few questions we have for you, and want to thank you for your support. And it's been from the very beginning. I remember when KTS-RBI began our partnership at UMC's Breast Center, and I do remember you being excited that finally someone was starting to understand the importance of 3D tomosynthesis mammography, and it wasn't the mandated standard yet. And our partnership helps to bridge financial gaps for women who at the time, or men that could not afford to have the better screening. Would you speak to our audience about how our foundation bridged those gaps and made 3D affordable to anybody who wanted the best possible screen?
Oh, absolutely. So we've been so happy about our partnership with the Karen T. Stahl Research and Breast Institute here, because it has really been a life changer for some of our patients. Some people may not know that 3D mammograms actually cost more than a standard 2D mammogram, and for a long time that was not paid for. You had to pay for that out of pocket. And some patients who we see who have such low income, things are paid for, but where it's really, this partnership and the funding has really come into play is for those patients who may have insurance or may have a little funding, but didn't have that extra step to be able to give them the choice in what type of screening they had. So our partnership with KTS-RBI has allowed those women to be able to receive 3D tomosynthesis mammograms and not have to choose between paying for that or paying for another bill, whether it's their electricity or a grocery bill or just putting gas in the car. So it's life-changing for some women. It truly is.
That's an excellent point. And we were finding that patients were having to decide, should I have this better screen and stay healthy for my family's sake, or do I put it towards groceries? We never, ever want anyone to be put in that position. And I'm so glad that you guys partnered with us so we could help as many people as possible. 3D Tomo is extremely useful in finding cancers as small as 2 millimeters. And that's smaller than a pinpoint for those of us who didn't do well with metrics in school. It's also useful in the detection of patients who have dense breasts. Would you mind explaining to our audience exactly what dense breasts are and how 3D tomo mammograms can be a life-saving first line of defense and early detection?
So in simple terms, dense breast is just referring to the amount of fibroglandular tissue and fatty tissue that you have in your breast. So the fibroglandular tissue is the functional tissue of the breast. If you have more of that than you do breast fat, then you're considered dense. If you have more fatty tissue than the fibroglandular, then you would not be considered dense. So how tomosynthesis plays a role in patients with dense breasts and other patients as well, but specifically women with dense breasts, is it allows us to be able to see through layers of breast tissue. So a 3D tomosynthesis mammogram, it's taken the same way, in the same position as a 2D mammogram. The difference is that multiple x-rays are taken over different angles while you're in compression. So what that allows us to do at the workstation is actually scroll through the layers of breast tissue. So we can find the tiny cancers that may be hiding in the fibroglandular tissue. Because the fibroglandular tissue shows up as white on a mammogram. Unfortunately, cancer shows up as white on a mammogram too. So you can imagine, the more white in the background, the harder it is to find the small white spot in that full haystack.
And I'm glad you mentioned that about finding those tiny cancers. It's very important to do self breast exams, but also very important to do the 3D that you would not necessarily find with a self exam. And correct me if I'm wrong, but dense breasts don't necessarily mean large breasts.
That's absolutely correct. Dense breasts, when we say dense breasts, we're referring to actually on your mammogram, the visual density. So it doesn't have to do with size. It doesn't have to do with how your breasts feel to you. It's actually something that's going to be determined by the radiologist that's interpreting your mammogram.
Excellent. And there's a lot of conflicting information in the world today about when is the best time to have your mammogram. Um, we get conflicting messages from the media, from different areas of the medical community. And I'm often asked, when should I have my first mammogram? Can you advise our audience on that little tidbit?
I would love to talk about age to start screening. So the Society of Breast Imaging and the American College of Radiology, as well as the National Comprehensive Cancer Network, all recommend to start screening at age 40 for any woman of average risk, and to continue that yearly as long as you're in good health. There are different recommendations out there. The important thing to know is that there's no scientific evidence to say that you should start screening after the age of 40. So there's no scientific evidence to say don't start your screening at 40. And actually, it's very important to know your family history, because it may be important for you to start screening even before the age of 40 for certain women with strong family history. It can be very confusing for patients and for even referring doctors out there to figure out, with all of these different recommendations, what to do. But I think the thing that we definitely know is that early detection saves lives. And the way that we detect cancer at its earliest is through a mammogram. So approximately 1 in 1,000 women at the age of 40 will develop a breast cancer, and your risk only increases from there. And so I recommend, and the Society of Breast Imaging recommends, that you start screening at age 40.
Well, I was the lucky 1 in 1,000, and at 40, my very first mammogram. I won the prize, but caught it early, and I was very lucky to have done so. So if you're putting off that mammogram at 40 because you're scared or you think it's going to hurt, just put your big girl panties on and go get it done, because it's important.
It's very important. And the patients who are younger that develop breast cancer when they are younger, those are the ones that we really are able to save so much of their life with early detection, rather than finding it, a couple years down the road when they're feeling it.
Yes. Another question I'm asked is, should I have a mammogram during my childbearing years, especially mothers who are nursing or plan to nurse after having a mammogram?
So there's a couple of things to consider if you're pregnant or nursing. We do recommend that if you're pregnant, that you hold off on a mammogram if you're not having any problems. And that's because there is some X-ray, a mammogram is an X-ray, which means there's some radiation associated with it. So anytime we can avoid radiation to a fetus, we try to. That does not mean that you can't have a mammogram if you're having a problem. Ladies who are pregnant still develop cancer. And so if you're experiencing a growing lump, you should definitely let your doctor know. And it will be determined whether it's appropriate for you to have a mammogram, or if you need another test like an ultrasound instead. It's totally fine for you to have mammograms during your childbearing years. If you are nursing, typically we would want to wait until you finish, but if you plan on nursing for a few years, then it's just important for us to know. It doesn't do anything to affect your breast milk, or there's no harm once the baby is born.
I'm so glad to hear you say that. I'm asked that often, and I didn't have an answer. So that's good to know.
Yeah, a lot of times we take it on a case-by-case basis with our women who are breastfeeding. Some have a higher risk than others. And so, rather than waiting for them to stop breastfeeding in another 6 months, then we'll just go ahead and do it and keep them on their schedule, because we take each of those patients individually, as a risk benefit. But if you're anybody who is pregnant or breastfeeding and you want to know, talk to your doctor. If your doctor doesn't know, then they can always call their friendly radiologist. We'll help them figure it out.
And you are a friendly radiologist. And I'm guessing that a discovery or a lump would fuel that early mammogram, or a family history would fuel that reason to have a mammogram earlier than age 40 more than anything else.
Absolutely.
Why do you think people put off having mammograms?
In my experience, people have said things that they were afraid it was going to hurt. And even things like, I was afraid that you were going to find something.
Mm-hmm.
But I remind
Fear of the unknown.
Yeah, just fear of the being told that there's something, and they're concerned that it's a cancer. But what I try to remind all of our patients is that mammograms are there to find something, and to find it as early as possible. It's the best tool that we have, and it's the best way that we're going to be able to save your life, is to find the cancer early. Ladies who are particularly sensitive to pain, if they're still in their childbearing years or menstruating years, I tell them, well, then have it the week after your cycle. Schedule it for the week after your cycle.
Good advice.
Yeah, you can even take some Tylenol ahead of time. It's not a painful test. I do my mammograms, and it's not, granted, none of us find it to be comfortable, but it's not painful, and a little discomfort to be able to have the peace of mind of knowing that your breasts are clear, or at least the peace of mind of knowing that if something's there, you're doing it routinely, and it should be caught early.
And I've had a gazillion mammograms, and it's not painful. It's not, it's probably scarier if you've never had one, because you're imagining this crushing machine. It's not like that at all. And if it's done properly, it's not a painful procedure. And for the peace of mind you get for it, it's worth every second of doing it.
Absolutely.
Well, I really appreciate you joining us this afternoon, Dr. Morrell. I know you're very busy, and I can't thank you enough for being a supporter of KTSRBI from the very beginning, and a believer in us, because we believe in you too. And we thank you for everything that you've done for our community.
Oh, thank you. Thank you so much, because you're out there doing the good work.